Hello team, thanks for joining this month's staff meeting. Our first agenda item is critical result reporting. The safety team has noticed a decline in our documentation of notification and reporting critical results to our providers. As you know, this is a 2020 National Patient Safety Goal by the Joint Commission, and that goal states to improve staff communication by getting important test results to the right person and doing that on time. So how are we going to improve this? We're going to start doing daily audits. I know it's everyone's favorite thing to do, but the purpose of this critical result audit is to ensure communication is occurring in the appropriate time frame from the bedside nurse to the provider, and that the provider is returning that call, page, text in the appropriate time frame. And this ensures that we're having communication that's closed looped and keeps the patient at the center of care and keeps them safe. So when you receive a notification, and this notification come from various departments, right? If it's a critical lab value or a critical CAT scan result or ultrasound result, you'll provide your name to the calling department. You'll note the time the critical result was called, and you'll immediately notify the provider. Note the time that you called the provider, but then also you'll note when the provider returned the call, and you'll document what you and the provider discussed. Maybe there's no intervention. Maybe it's a white blood cell that's trending down but still critical. You'll still document what that conversation was. So to ensure timeliness of reporting and timeliness of receipt by the responsible caregiver of the critical test results and values, we'll begin to randomly audit this. These audits will be done partly by nursing leadership, but also by you as the bedside nurse. We'll provide you with the critical results with a specific patient medical record number, and you'll be responsible for finding that documentation. In these audits, you'll look in the medical record, and you'll specifically look under notification, which is where we're to document these interactions. You'll know the time the provider was called, when did the provider call back, and then also a note to this is that if for some reason the nurse needed to escalate, maybe they have paged the physician twice and it's now reaching closer over to 30 minutes and they've yet to receive a phone call back. So that should also be reflected in the documentation. And typically, just as FYI, and in the policy, it discusses how you escalate and to who. You would escalate to your charge nurse and then the house supervisor and then eventually the administrator on call. So you might be wondering, why are we doing the audits? So this is a super quick audit, and it'll give you insight to opportunities not only in your own practice, but in your teammates' practice. This way you can support your team, know the why behind it, and if your teammates ever have any questions, you'll be able to answer that. This also aligns the team with our culture of always being survey ready. Not notifying the provider in a timely manner when a critical result has been called to the nurse violates hospital policy, but as you guys know, it puts our patients in danger, and that's something that we're really focused on, and obviously we do not want to do. By not notifying the physician, it can cause increased length of stay. It can cause higher mortality rates, complications, physician dissatisfaction. So this is a big piece of what we do in critical care to communicate openly with our providers. The nurse will be, so once the results are completed, those results will get turned in from the bedside nurse to the nursing leader. And then we will go through those results and we will have coaching sessions with nurses who maybe are having difficulties documentation, understanding the policy. And we want to really find out, where did the failure come from? Is this a coaching situation? Or are there barriers that we're not aware of that need to be discussed? So it's really important to us that the people auditing have that information, report that to us, and then that we do follow up and find out the best way to support you guys at the bedside with critical results. I'm very confident after this education that we will see our critical results reporting audit improved to 100%, because I know that this team is very dedicated to patient safety. And I have provided all of you with an example with a screenshot of where these notifications are documented. I will say sometimes, as you know, in all facets of nursing, things get busy, and sometimes these can be documented in nursing notes. We will still accept that, but it still has to have the requirements of when they were notified, the time the physician was notified, what time the physician called back, etc. So typically what I have found in nurses' notes that all those areas are not documented, which is why it's so important to use that specific intervention, because it really does quickly walk you through the steps, and it gives you all the information that needs to be captured, and it makes it really easy to go back and audit it as well. And then also show a surveyor. So surveyors will be coming and visiting our unit, which obviously will welcome them, because they're here to make sure that we are ensuring great patient safety on our unit. And so that's an easy place to go and show that surveyor, yes, we did see that critical CT scan. Yes, we did notify the physician. This is when the physician called back, and this is what we did related to that CAT scan. So I provided you all with an example of the audit tool. It's a very, very basic audit tool. You have the medical record, you have the critical result that was called and who it was called to. Remember before I mentioned that when that person calls you with a critical result, they'll note your name. So it has that person already on there. Then you're gonna go into the nursing documentation, and you're gonna look for when was that physician or provider notified, when did they call back, etc., the things that we've already talked about. See, I've also provided you with a copy of the policy, and the policy has purpose. It has why we're doing this, which we talked about for national patient safety goals and patient safety. It also talks about definitions of terms, what the procedure is for inpatient. Obviously, we're an inpatient unit, but outpatient units also have critical results as well. So I'll provide you with that. Screenshots as well. It's a really basic nursing screen, but then that way you know, as someone who's auditing, exactly what we're looking for, and if there is a missing piece, you know, how to provide that information. I've also provided you guys a copy of the National Patient Safety Goals. We talked about this one in particular, but there are multiple. I think it's always good to have that front of mind. Some of them are new this year that weren't last year, but quite a few of them were brought over from last year. And then, so these audits, we are going to start tomorrow. And this nurse is going to be randomly picked. And obviously, if you've got a one-to-one or a critically ill patient, we're going to take that into mind, and maybe skip you that day. And we're only going to have you do one or two. So this will be picked by the charge nurse. And you have the entire shift to complete it. If there are any questions, any concerns whatsoever, we're going to be right there. We can walk you through the first one, and then the next time you'll kind of know what you're looking for as well. These will be turned into me, and then myself or the nurse leader will be doing follow-up if there are fallouts. So this will start tomorrow, and if you have any questions or concerns, please let your nursing leadership know. We're here to support you. I know we can work together as a team to ensure this documentation is adequate and meets our policy requirements and our goals for patient safety. And I appreciate your time and energy and your focus to this and keeping our patients safe. Thank you so much.